we have a situation where we didn't learn from history. I think that one of the ironically tragic things for the United States and for Mexico is that we were spared the SARS epidemic. Because if you look at what's happened globally, the best predictor of the countries that managed to quickly control the COVID pandemic are those that had previous experience with SARS.
It is amazing that just in 4 months since the first case of this novel disease was reported, we have now more than 2.7 million people affected, close to 2,100 deaths. This is the fastest ever expanding pandemic in the history of mankind. So these are examples that intervening early and aggressively is what makes a huge difference in the spread of the epidemic. Why is it that Mexico has such a high fatality rate? It has to do with the comorbidities, meaning lots of obesity and diabetes in Mexican adults, which are predisposing factors for fatality. Something about health equity. You have seen in the newspapers, in editorials, the fact that Hispanics and also Afro-Americans are disproportionately affected in terms of number of cases, but also and particularly in number of deaths. Why is that? Well, Black and Hispanics have social determinants, housing crowding, poverty, and then the comorbidities, hypertension, diabetes, obesity, that make them more susceptible to a severe disease or even death.
Mexico essentially followed the US's path. It didn't ramp up testing. It didn't effectively isolate people with the infection. It didn't effectively do contact tracing and quarantining. So the question is, what's the way forward? The only thing I'm a little bit more pessimistic about than Jaime was, is the timeline for a vaccine. I hope he's right, and he might be right, and Tony Fauci agrees with him that it's possible, but we've had lots of coronaviruses before, and we've never made a coronavirus vaccine. And many people would like us to have had a coronavirus vaccine against the coronaviruses that cause the common cold, because none of us like colds, and many of us would pay for that vaccine. But we don't have a SARS vaccine, we don't have a MERS vaccine, and we don't have a vaccine against the coronaviruses that cause the cold.
So what's the Mexican government doing? They are doing basically two things. They are doing austerity, and they are providing microcredits. So the logic is that they are going to reduce expenditure in some areas of the government in order to increase the number of microcredits that they can provide to small businesses. So the money that is saved on this austerity is going to use to do two things. One is to keep the Mexican government, whatever is left of the Mexican government, working. And the second one is to increase the number of microcredits. So what is the Mexican government not doing? So they are not giving cash transfers to the poor. They say they are doing that, but in reality, there is no more cash transfers than regularly the Mexican government gives cash transfers to 22 million people. That's exactly the same number of people that are going to get cash transfers during the coronavirus.
Now we'll go to the political part and to try to understand the Mexican economic response. You know, it's very telling that Andrés Manuel López Obrador and AMLO, they continue to, I will say they continue to have a honeymoon. They exchange letters, they talk to each other. This is hitting us very bad in terms of remittances. Remittances has become the single most important source of foreign resources and foreign reserves. And last year, we hit a record of about $36 billion were sent to Mexico. This is very important for Mexico. It's 3% of our GDP. Immigration. There's not a honeymoon between AMLO and AMLO and Trump, they basically do not talk about immigration issues.